and we'll go down the line here. So item 2 will be approval of the agenda and changes to the agenda and approval of agenda, and we do have some changes. So consent agenda item 8.9, revised instructional salary schedule, is deleted. Superintendent's human resource recommendations item 9.11, employee suspension, is deleted. And information technology seat management contract correction to item 12.1. The correct task order number is 2-166, camera outage repairs at Baker School, Blue Water Elementary School, Bob Sykes Elementary School, Bruner Middle School, and Central Administrative Complex. So now we'll move down to Section 3.1, recognition of the 2019-2020 Kids Tag Art Choice Award winners, presented by Ben Anderson, Okaloosa County Tax Collector. And Mr. Chambers, I know some of my fellow board members were asking how we were going to do this on Monday night, so if you would kind of please explain how we're going to do this.
Absolutely. And first of all, I know myself, just like all of you, we appreciate the work that Mr. Anderson and his group that they do for our schools, and especially our art programs. As you may recall, in the past, we had a lot of students who would come here to the board meeting, and we would recognize those students. Now, we will still recognize those students, but those will be done at the school level. But there'll be 3 overall winners. There'll be the Tax Collectors Award, the Sheriff's Award, and then the Superintendent's Award. So 3 students and their families will be here. So we'll have the family come in at a time. So the 2 parents or the 2 representatives or 1 representative with the student will come in. We'll recognize that student, and then the next will come in, and then the next. So it's a little bit smaller, but still a great celebration of the work that our students are doing, and thanking Mr. Anderson for his support of our art programs and his support of our schools.
Okay. And I agree, Mr. Anderson has been a friend to the Okaloosa County School District for many years. So. All right, so we'll move down. We have no visitors. Administrative personnel appointments, we have none. Public comment, 6.1, members of the public desiring to address the school board. And as y'all know, we had the special meeting. We had our, I think, 76 call in and or attended, I think, all together. So it was a lot of public comment, and we do appreciate public comment. So. And now we're down to 7 committee and staff reports, and this will be for today only. So, Mr. Chambers, you have 7.1.
Yes, sir. And I'm going to have Mr. Horton come up. But some of the things that we're going to talk about will be giving an update to the board on our brick and mortar numbers, as well as our My School Online numbers. And the interesting piece was on Monday, the very first day of school, we had some families that wanted to come back into the brick and mortar. So we did know it was important that we did get a deadline out there, because as you can imagine, as numbers fluctuate with My School Online or the brick and mortar, there's teacher placements that are impacted, teacher numbers, student numbers, class size, safety measures. So all of those things are important. So we had to have a deadline. So Mr. Horton will talk a little bit about that and the numbers. Also, at the end of the first 9 weeks, families have the opportunity to come back to the brick and mortar. So October 9th will be the deadline for families to declare that they want to come back to the brick and mortar for the second 9-week period. That'll give us about 3 weeks to do all the schedule changing in the brick and mortar or to the online. There could be online teachers that would need to come back to the brick and mortar, depending. So we want to make sure that there's enough time to do this in an organized fashion, and we can communicate appropriately with all the individuals. And Mr. Horton will give a food service update on the free meals.
Okay.
Thank you, Mr. Chambers, board members. So, as Mr. Chambers mentioned, we've had students that have come into and left the building all during the first 2 weeks of school, and the schools themselves, the teachers, the administrators have done a great job helping to manage that process. And it's never going to be 100% smooth. Sometimes there's a waiting period for kids who are transitioning to online for their resources to be uploaded and made available to them. So I appreciate the patience of the parents through this first 2 weeks of school. It feels like it's been a month and a half, but it's been less than 2 weeks of school. We did peak last week at 8,083 My School Online students, 8,083. And we have started to see a return to school buildings more heavily at the elementary level. And so as of this morning, our My School online enrollment is down to 7755. So about 325 students returning to the building. And again, much of that's at elementary. I've had reports of 15 to 20 coming back into the building at elementary. So the challenges in doing that are, as Mr. Chambers said, making sure the resources in the building match the students as they come into the building. And what we're not in a position to do is hire new teachers out of nowhere to kind of service. So the schools right now are keeping up with me and letting me know where they believe their critical grade areas are, where class sizes may be creeping above 18 or something like that, and they're able to do that in a class size environment because class sizes are calculated at the school level now. So we do keep track of that. But there'll be a tipping point that you can imagine, and it's never going to be super simplistic, but I may have a teacher who's an online teacher for a particular elementary school, and because of movement back into the building, that teacher's enrollment has now dwindled to a point where it might be appropriate to invite that teacher back into the building, and the few students who are left to do a very careful and thoughtful handoff to a teacher who may still be teaching My School online. And so we understand, and certainly in the building, when you're dealing with a teacher face-to-face, schedule changes and teacher changes are always things to be concerned about and respectful of parents' opinions about, for sure. In an online environment, there's probably less direct communication with the teacher and the students more working in their platform. And so we think there will likely be some opportunities to do that. And again, that'll all be incumbent upon what the numbers are starting to look like in the classroom, because we did not staff elementary schools, and any school for that matter, at low numbers in both the online and in the building, because that would require additional teachers. And just as a follow-up, at the elementary level, it looks as though, based on what our projections were for enrollment, we're probably 250 kindergarten students below that, right? And so it could be that some parents opted to just sit out a year, and it could be that some of them opted to do some homeschooling instead this year. But whenever our actual enrollment doesn't match our projections, then we have to be very careful and thoughtful, because, as you know, our funding comes based on the kids that we have enrolled in our schools. So the good news on that is we actually have 15 fewer kindergarten teachers, because I'm tracking kindergarten, than we otherwise would have. So we're happy to report that we don't have an abundance of kindergarten teachers. We believe, the right number based on the actual students enrolled. But as they come back into the building, we'll have to make sure we transition everybody appropriately. And so that's part of the reason behind the first deadline, which is actually today, for parents to notify us that they want their child to come back into the building. That will really let us take a look at any shifting and staffing that may need to occur, if that makes sense. And so that leaves us at about 25%, maybe a little bit over, in terms of My School online versus brick and mortar. So about a 25-75. It crept up a little bit, but now we're kind of back down there. So I can answer any questions you have about that now, or I can move on and discuss food service a little bit, and then kind of answer questions you have about either or both.
Why don't we
Yes,
just,
sir.
since we're on
Okay.
this topic, I'll start with Ms. Ivanchek, as always, on my.
Yes,
and
ma'am.
she's got.
All right, so we have had students coming back in and leaving, right?
Yes, ma'am. It's a net,
Uh-huh.
a net 325. So we've had some still continue to move out, and we're committed to allowing that to continue to happen as individual situations arise and parents want to move their students to online. We're continuing to let that happen.
Till
But-
October 9th.
No, ma'am. That movement online can occur at any time. So let's be clear about that. So a family's in a school building and they have concerns that are new-founded. Maybe there's a family member at home that has an illness or someone that they're living with. We want to make sure we provide that family the opportunity to move from the building to online at any time. The movement in the other direction is what we have to put a timeline on our deadline. So we're saying today, and we notified parents by call out and social media, and our schools have done a great job getting the word out to families that today would be a deadline, a first deadline, for wanting to come back into our buildings. And I liken it to, in college, the drop-ad period. And so we've made it through 7 or 8 days of school, and now parents have, for whatever reason, decided to bring their child back. They let us know. We will fit them into a seat in the classroom. But after today, I think it's important that we have some control over the number of students coming into the building. Now, clearly, if I've got a kid who's coming from Georgia and registering for school, they're going to be able to enroll, obviously. But the October 9th deadline that Mr. Chambers mentioned is we want parents to now start to think about the end of the 9 weeks. Because we've said to them in our reopening plan that they can come back at the end of the 9 weeks. And it's a better transition time for grading and otherwise. And so we're asking our parents to let us know, and we'll continue to let them know through call-outs and school contact. Think about this. Be thinking about this. By October 9th, which is about a month from now, let us know if you want to come back in the building. And when they let us know that, the idea is they're coming back then at the beginning of the second 9 weeks. So they're giving us some lead time to say we're coming back, and that'll allow us to prepare, make sure our teaching assignments are accurate for the beginning of the second 9 weeks. Does that make sense?
Okay, so the ones trying to come back in after today's deadline, okay, do we have parameters of situations that would warrant, like you said, there are those, but we're going to kind of keep to that so that we don't have those that are trying to come back and forth on a more regular basis, so we're making that clear?
Yeah, so the hope is right now, after today, that we're in a dead period, so to speak.
Right.
And the only way that we would go against that is if, let's just say, a family, someone may have lost their job where they had the flexibility to be at home because they were teleworking, and now they have a new job and they have to be at work, so they're not able to keep their child at the house. So I think we need to be flexible in that situation.
Right.
But where we can't be flexible, just because of all the dynamics, is I've just changed my mind, and we just want to come back to school, which we feel for, but we just can't have constant flux occurring throughout the entire 9-week period.
Okay. Yeah.
And if I could just
Yes, sir, go ahead.
follow up on that, Superintendent, I remember that a part of that is because of the employment decisions.
Yes.
Right.
That have to be made as those students come back into the system, coupled with the complexities associated with class size. And so all of those things I certainly understand, and I appreciate your compassion for those folks that find themselves in those really tough situations, but I also understand why there are issues associated with just coming and going in terms of employment. So thank
Yes,
you
sir.
for that.
And that was another bullet, Dr. White, is our FTE for our funding. Those trials begin next week. And FTE week culminates October 9th. And so we are still mandated to meet class size. And so if you imagine if there's a flood of students coming back into the building the first week of October, and we don't have the staff to properly place those students and meet class size, then we'd be in that basket. So it is critical that we help control that process. And again, online students do not count for or against class size. It's like they're not a part of that calculation.
I'm good, thank
Okay,
you.
Dr. Kep?
So this will probably be an unusual question, but I know and I appreciate that Mr. Horton lives in the world of quantitative studies, and those numbers are imperative, and we all have to follow those. But could you maybe discuss any qualitative measures or ideas or thoughts? I know the superintendent mentioned briefly about families and work. So are we noticing any movement that might be qualitative with regard to concern about mask wearing or concern about virus outbreaks or any of those things? Is movement related to that, or maybe it's totally unrelated? I'm just trying to get a feel for that. Are those the concerns that are out there?
I think I don't have a summary of those for you. I have some anecdotal pieces. I've heard rationale from one end of the spectrum. We don't enjoy the block periods at the school, and so we're going to do the online. But I've only heard that in a single or separate case. I have not been informed of anything particularly about masks one way or the other. Certainly, all parents have a right to their thoughts about, what the school should look like, and if there was an unlimited amount of money and space and personnel, what it could look like. So I would imagine, Dr. Kelly, there are some that are making choices based on what the school environment looks like. I think there are some making choices the other way because 2 weeks into the online piece, they've decided it's not the right fit for their kid.
They don't like the
sometimes
curriculum or-
Yes, ma'am. Sometimes in the summer, the thought of being there and doing that daily, it just seems like it will work, and then it just logistically doesn't work out. So I think the movement back into the building, obviously the parents, if they feel like it's not a good fit for them in the online and the platform or the curriculum or whatever it may be, we've given out about 1,600 devices for families for free and reduced lunch to get those families access and be able to work. I keep getting reminded because I'm always kind of looking at the last 2% of getting some of these things fixed that are issues, but we've had 14,000 students functioning in the online environment. Some of them do very well, some of them don't. But I can get a little bit more feedback from principals, from the registrars, see if there's some themes, but those are the main themes that I'm
Just
hearing.
for curiosity, if there were themes related to any of those things.
Yeah.
Thank you. That's all.
Okay. Dr. Whiting?
Right, and Mr. Horton, I know that you have many, many job responsibilities. Yeah, I see you should probably too many, and I understand that. But you mentioned numbers, and I know that you also are involved in the projections for our school district. And as you said, that directly ties into our school budgets and the budgets that the school board has to approve. So I'm just curious, how are we doing in terms of what we thought our enrollment would be when we projected that, and what it really is? Can you tell yet?
Yes, sir, and I'll speak in enrollment numbers, not FTE, and FTE is where the money comes from, but generally speaking, when we do our projections for FTE, we base it on expected enrollment for every school, and a lot of that's grade level progression, students moving from grade level to grade level, and what the kindergarten expectation is for the upcoming year. So I did mention already that kindergarten is off by 250 at this point in time compared to September 20th last year. I pulled a date where I tracked that attendance. I think district-wide, where we want to be in October, it's about 650 students at the moment, which would be about, trying to do the math in my head, about 2%, give or take. So right now, we're still working through that first 2-week process. We're still having students enroll, but we're also taking students out who have not shown up. So I think that number right now is where, in terms of enrollment, it looks like we may be off. And Mr. Chambers had mentioned, and we looked at this historically, the district grows at about 400 to 500 students a year.
Right.
This year, we did not project that much growth.
Okay, good.
And so Rita can speak to the funding piece and the others, but we've been as cautious as we can with the most costly resource that we have in our district, which is instructional staff. And that's where hopefully we'll be able to show that we've not hired 650 students worth of teachers that are now teaching no one in the buildings.
All right. Well, more to come on that then.
Yes, sir.
Understand.
Yes,
And
sir.
I just want to add 2 things on that, and I appreciate that question. And I think we all know, I think projections happen, in the November timeframe for the upcoming school year. And of course, when those projections were made last year, COVID wasn't a thing. But then also, if you would talk to us a little bit about in the March timeframe when we start looking at allocations for schools and trying to be very prudent with the allocations that we do give out, and being cautious at the time because we knew where we were now in the COVID area. I know that we held some allocations back in terms of going into the school year. So if you could just discuss a little bit of that.
Well, Ms. Calnois does a great job of having some reserves available. There are FT reserves that are available each year. There are also individual year reserves. So Mr. Chambers is speaking to the point, and again, it's not a perfect science, but when looking at a particular school, we give out allocations in April and May. And so what we work to do is try to cut back the allocations that were given to each school at some level, unless their enrollment really did look like it was higher. We've also done a good job this summer, and again, I'll put it all back to the principals of the school. They understand that it's important that we don't hire positions just to hire positions. So they've all done a great job, and we've been able to pull back unused allocations even as recently as the last few days because we know the enrollment's not there. So it wasn't a situation where we went out with more allocations for this upcoming year than we had the previous year. Even though we expected enrollment to go up a little bit, we actually went out with about $1.4 million in fewer allocations at that time in the spring, being as conservative and cautious as we can.
Well, I certainly appreciate that on your part and the superintendent, staff, and those principals and those schools, because we all know that's how the school district gets paid. It gets paid on the number of students that actually attend. And sometimes it seems like it's a little bit unfortunate. I'll never forget when a former superintendent told me one time, Lamar, the day you find a legislature that will give you money for an empty seat, let me know.
I'll up at a school.
And they don't do it.
Right.
We're not going to get any money for empty seats.
Yes, sir.
And so I appreciate you guys being conservative on your employment practices to try to absorb some of that maybe we saw coming. Thank you.
Okay, thank you, Dr. White. Mr. Destin?
Mr. Horton, when is the final audit date, the last point where we get to claim the FTE funds?
So there is the 9th of October is the capture date for student enrollment, but there's a correction window that goes beyond past that. I'm not sure of the exact ending date, but there's an amendment window so that we can correct errors and assignments to students leading up to it. It is before the end of this year, so to be completed before we leave for the fall break.
So students that transfer in after that date, we simply don't get an FTE fund for them?
We would not receive a penny for them. And by the same token, if they're coming from another district, if that district educates them right up through October 9th, then they'll get half of the available funding for that student because they count them in October and again in February. And so, you could have a kid leave October and leave February, but have them the rest of the year, and you don't get funding for that kid at all. But I guess the ones you get funding on that aren't here the whole time, and the ones you don't get funding on because they're not here, somehow washes out.
We hope.
Evens
We
out,
hope,
huh?
and that's true. Then we have a military community, and so if the military community tells us they're getting an influx of folks at the end of October, then we'd take them in, and we would have missed them for the October FTE count.
But you say there's something in February?
There's a second count, yes, sir. They do it again in February, and they essentially apply half of our funding based on the October count and the other half based on the February
February.
count. I'm being way overly simplistic, but way overly
Okay.
simplistic. Read us.
Thanks.
And I just say that's why those reserves are so important
Yes, sir.
in case we don't get the numbers in both of those counts.
Yes, sir. And that's why it's important that those are not, they're not used for anything else. Because as I said, there's FTE reserves at the district level, and there's FTE available that we know not to use in a given year. So hopefully that'll be sufficient. Is there something else?
I'll just say I appreciate you being simplistic. It makes it easier for people out in the public to hear what's kind of going on, but simplicity goes a long way. So
It's
I just wish our legislators would make it simple too.
Thank you. On the food service update, just wanted to update the board on that. As you know, the federal government essentially extended their summer feeding program through the last day of school for school districts across the nation. So our last day in December, that means that all students regardless of whether they qualify for free or reduced meals, all students can get in the line at lunch and get a free meal, breakfast or lunch. They can't get in the a la carte line and get ice cream and all those other things, but they can get free breakfast and lunch meals. That applies to the 7,700 students who are My School Online at home. And so up until the beginning of school, we were contemplating the free and reduced lunch My School Online students who are home, to a process for them or their parents to come up to the school to get breakfast and lunch meals. And we were going to do that where they could come on Mondays and Wednesdays, and you can get multiple days meals at once. And so we felt like that was going to be the most appropriate way. We did have very few students or families, maybe 15 district-wide, do that last week. Now that process is open to all 7,700 My School Online families, and we're preparing and just getting ready. So the schools, again, great job. Just so you know, each school's establishing a window of time during the day on Monday and a window of time on Wednesday that's limited, and advertising to families, if you want to come get grab-and-go meals like we did in the summertime, come up to the front office and get them. They won't be able to go back to the cafeteria. There'll be a process by which they come to the front, and then we communicate, and the meals are delivered. So that's happening. In the building, what's happening as a result of now, any kid can get into the line and eat breakfast and lunch. So the first concern is longer lines, more kids. We're not totally seeing that yet. For example, at Crestview High School, I think they reported 50 more kids. Food service went up. Antioch, 90 more, so more elementary kids. I have heard reports that teachers, children are going in and getting the meals that they're entitled to get. So it might be a way to save a little time at the beginning of the day and get the kid some breakfast there. So we don't have some overall numbers yet, but we'll know better after another week what the impact is. So keep in mind, the nutrition group looks at their meal service compared to last year. Well, with so many students out of the building, their meal service numbers are down. So this opportunity for all students to come into the line and eat meals, and they are reimbursable meals, is actually bringing back some of the food service numbers that we were looking for. So we'll update you as I get some more numbers on that.
Well, I will comment. I was at Blue Water Elementary on Thursday after we had our agenda meeting, and it just happened to be the beginning of lunchtime when I got there. And I was surprised to see how many kids were actually bringing their lunch from home. I even told Miss Clue I was surprised to see how many kids were actually bringing their lunch from home. So it was a substantial amount of children that brought their lunches.
Yes,
so.
sir. Yeah, they are.
I have a question.
Mhm.
How, I know this is federal, how's that being funded?
I think that the flow-through money, and I would have to defer to that, but I think the money comes through the federal government to reimburse for these meals, to the state, then to us.
Is it a special program like through the CARES Act thing? Is this that?
So it's not CARES Act, but it's a federal extension of the program, so I would, we're not paying for it.
That's the main thing, right? Okay, the other thing is that I've heard some talk about how typically, of course, parents fill out forms to qualify for free and reduced lunch, and that affects Title I numbers and funding. And so don't we need to make sure that these parents complete these forms, even though now they can just show up? Isn't that something that, am I correct on that?
You are correct, and thank you for bringing that up. It is vitally important, and this will be a nationwide phenomenon here, I'm sure. Our Title I funding, federal funding that we get and other federal funds is largely based upon the free and reduced lunch population in our district. So if we don't have, and we work hard every year, the schools do, to get those families to apply for free and reduced meals, because Amy Dale in Title I reports that information by school, and it determines eligibility for Title I funding based on schools. So if they are not doing that, then there's a real risk that the school or our Title I funding is less because of it. So that's the only thing that I feel a little bit comfortable about is I know we'll do a better job than most other places in getting these families to apply, and it will be a national question about how those title funding pieces stay in place.
But I'm sure we're taking action to contact those.
We are. Well, our principals were the first ones to say, hey, we got this, because that funding supplies funding for resource teachers and materials, so it's critical that we continue to
Is
do
that
that.
a electronic file, or are we still doing some paper?
There's both. So there is a website, our website, at the bottom of our main page has food service and free reduced lunch application, and a school can also help a family fill it out, paper-based if they need to.
Okay, thank you.
Ms. Vancheck, I'll follow up with that. I know Thursday we were talking about this after our agenda meeting, and again, challenging the superintendent to challenge his teams to come up with creative ways to get people to not just do this, but any forms that we need filled out. And I think it was evident during this pandemic situation that we're in, how our teams have rose to the occasion to get people involved in what's going on in the schools in creative ways. So because of how important that is, challenging our school teams to get those parents to fill out those forms, I'm kind of curious to see what creative things they're going to do here over the next couple of weeks. So,
And I'd be remiss if I didn't mention, I'm working with Ms. Scallon, federal impact aid cards are going out on the 18th of September. So we have about 7,700 families who aren't in the building that we can hand a card to or put it in a backpack. So Ms. Scallon's group, will be mailing out those impact cards to those 7,700 families. And just so you know, about 1,300 of our students online are military. And so that's 1,300 families or less, if there's multiple kids in a family, that we would really want them to respond to that impact aid card. And again, for the viewers, that's the federal funding that school district receives because a lot of our property in our county is military property and non-taxable. And so Ms. Scallon's group is going to be sending those out by mail with a return envelope to try to make it as easy as possible for these families to respond. And I've already got the call out programmed in the system to go out September 17th to remind folks what's going on. But that's another example of what schools can help to do, because they're still connected to their My School Online families. And so there's an administrator at every school. And so we'll challenge them to make sure that they're working to get those cards back.
So, Dr. Hale, we know about that, right? The pizza parties and the whatever for the homeroom that brings those cards back first. So there's ways that schools do to promote that.
hey, curbside is a popular thing these days. We could do a curbside there.
Yeah.
I work in food service too, so be careful.
Okay. Dr. Kelly?
Oh, good.
Okay. Dr. White?
That's good, thank you.
Mr. Destin? All right. Thank you, Mr. Horton. We appreciate
Yes,
you.
sir.
All right, so we'll move to 7.2, in-county travel, paid for the period of August 6th through the 26th, 2020. And 7.3, update to board members on the performance audit of Okaloosa County School District. And Mr. Horton, you're up again.
Thank you, Mr. Bryant. Board members, this document that you have before you is a result of legislation that was enacted in 2018 and requires the completion of a performance audit prior to any referendum to adopt a local discretionary sales surtax. So this is a statutory requirement of school districts and county municipalities that are seeking a sales surtax on a referendum item. So I provided this to you, and I wanted to share with you a little bit of my thoughts about it. And Ms. Scallon was integral in this process as well, in working with these auditors. And I want to go over a couple of things with you, and then take any questions that you have. The objective of this audit was to fulfill the requirements of Florida Statute 212.055, and it requires us to go through this, and it must be done within 60 days of the referendum. And so the referendum's on November 3rd, so the audit company working with us met that deadline. We are required to now post this final report on our website, and that was done last week. It can be found in our finance section. It can be found in our facilities and maintenance section. It's also tagged to instructional technology and transportation. And the reason is because those are the areas in the referendum and the program that we're seeking to benefit from the surtax. So when the auditors come in, they look at those areas that the district is seeking funds to support. And those would be, as we mentioned before, facilities and planning, maintenance, transportation, instructional technology, school safety, and then even finance as it relates to that piece of it. I want to read a couple of things for you, and then, like I said, address some questions. The ultimate statement that we received from the auditors was based upon the procedures performed and the results obtained. The audit objectives have been met. So when a group comes in and performs an audit, they could determine that different research areas that they review are either not met, partially met, or met. And in Okaloosa County, there were no subtasks, no areas that were not met. We had areas that were partially met and areas that were met in terms of subtasks. As you or any taxpayer reviews performance audits for school districts from around the state, they will find, and you will find, subtasks in all of them that are partially met or met. And so we're pleased that the district received nothing that was not met, and we were given the green light, at least from the performance audit standpoint, to move ahead. Now, that does not mean there are not recommendations for us to consider and to take up as we move through this process. That's the same with all districts. And so I wanted to read a few comments that were made in audits. So if you just bear with me there, it's brief, but I want you to hear these comments, and then I'll have a follow-up comment. Comment 1, the program goals and objectives are not measurable, and as a result, it is unclear whether they can be achieved within budget. Comment 2, with regard to correcting erroneous information on the website, an audit found no formal procedures are in place to document the process procedure that should be followed, ensure all appropriate staff are knowledgeable of these processes and procedures, and to ensure consistency. Those are comments from the performance audit for Duval County. And I'm saying that not to say that our focus shouldn't be on our own district, which it should be, but is to provide some context for performance audit for folks who don't typically look at these things. I think it's important. Finding, facilities program performance lacks documented goals and objectives. Hillsborough County's performance audit. Now, Hillsborough County is a mega county, as is Duval for that reason. So what we have are findings / comments from the OPAGA selected auditors who happen to be from Houston, Texas. We did conduct all this with 7 auditors from Houston, all virtually through Zoom and emails and phone calls, and it was a monstrous task. One final comment. The strategy and process to identify, prioritize, and initiate projects does not appear to adequately represent a best practice in the field of construction and facility management. That's Alachua County. And so again, I'm not focusing on other districts. We have ways and opportunities to improve what we do in our district. And I think you'll hear in a minute there are things already in process to address some of these, but it is a context. I think we all should be pleased that the performance audit's complete, that we were given the go-ahead to continue. We'll share this information out with the groups in the community that are supporting, but it's posted on our website and available for review. OPAGA itself, which is the governmental agency that kind of oversees this, they don't do the audits themselves. They contract out to have those done, as I mentioned. The OPAGA website contains some performance audit review information, but nowhere on their site do they have a listing of all of the performance audits that have been done for school districts that I can find, and I've inquired. I did mention Duval County, Hillsborough County, and Alachua County because those are 3 counties who recently, since this legislation passed, have performance audits similar to what we've done, and those are available on their website statutorily for 2 years, so they can be viewed as well, and you can see some of the findings that I presented here. Certainly our recommendations and findings are in our own report, and some of them sound similar to this, Some of them, I know Mr. McGinnis is already working to address an example. I'll give you an example. I know because I'm part of the process with Mr. McGinnis, that we review our policies every year with regard to legislation. So when legislation comes out or new rule, we look at that and we say, how does this impact our policies, your policies, and do we need to make some changes? So we do that every year. We were given a finding for the fact that we didn't have a policy to say that we did that regularly. And so you'll see some of the information in this report of that nature, where I think we bring a sentence policy back that says we'll do this however often the board wants it to be done, knowing that it's already being done. And so some of this is about the documentation piece of it. And so those pieces where we can take that action, we're responding to the audit saying we're taking that action. There's another situation, and I think our transportation department does a great job with the most aged fleet in the state, where we had a finding that essentially asked us or told us that we don't outsource enough, or we need to consider certain processes. And we do outsource many things in transportation through competitive bid, and we've done that. I think that I was just given a state report on transportation services for Okaloosa and Santa Rosa for the latest year that was available, that showed, and I've yet to study it in detail, but about the same ridership that we have in our district, but that Santa Rosa's cost was about $2 million more than Okaloosa's. And Santa Rosa has privatized transportation. So I think every finding that's in here we will look into and we will address, and we will strive to be better. And that doesn't necessarily mean that every finding is something we'll take direct action in accordance with that finding, but we will review everyone thoroughly and make sure that we stay updated. And in fact, when the state auditor general comes the next time around, one of the first things they'll pick up is this OPAGA performance audit, and they'll look at what we've said we would do in response to this performance audit and track us to see if we've done it. So that's kind of a follow-up piece on that. And then the last thing I'll say about this particular performance audit, the board members in the referendum contemplated that the Citizens Oversight Committee, and so every inch of this capital program as it relates to the sales surtax would be overseen by a citizens group. And Mr. Chambers will talk about that a little bit this morning too, because we're going to ask each board member to provide a representative from your district that would be willing to serve on that. And we'd also like to ask the chambers to produce a person so that we can bring back a group to you at the next board meeting, hopefully to approve to be a citizens oversight group. And then just again, so everyone who's watching knows, that group was subject to all of the Sunshine Law requirements. We'll be publicly noticing all of those meetings and training those folks and making sure that group provides a layer of certainty and oversight to the process involving hopefully the sales surtax funds that gives the public a level of comfort and trust in what we're doing.
Any comments? I know we all had meetings with Mr. Horton and Ms. Scallon regarding the APAGA report, but I'll start with Ms. Ivanchek.
Yeah, I think it's an excellent report. To me, anytime you're going through an audit or an evaluation or something, then there's always things that can be tweaked or looked at. We're always trying to strive to get things better and more streamlined, whatever. So everything I saw here was in that kind of category, that not that we weren't meeting what we needed to do. But like you said, you're going to look at some things and see if we can't tweak them a little bit different way. But I think the public should be, happy that everything looks great and we can move forward with that group on that, sales tax piece. So thank you for a great report.
I do just have a couple of comments that I want to reiterate. You did state these, but I want them to be highlighted and in bold letters if possible, just because I would like to dispel some things that may be going around. Number one was, you said, and is very evident in that report to anyone who reads or who even glances at the charts in that report, we had no area and no sub-area that was not at least partially met. So we had absolutely 0 unmet criteria in that report. And secondly, all of the interviews for this report, for this audit, were done by phone or Zoom. Not a single person in that review group came into Okaloosa County, walked through our offices, held our documents in their hands with some of our people shoulder to shoulder, and had a discussion face to face. Every single one of these was done at a distance, which I think is a disservice to anybody undergoing such an audit, because if you come into our district, you are immediately hit with our culture of openness and friendliness, and the fact that we do such a, I think, a fine job at collection of data and reporting of our data. So I think those were 2 things of disservice. And just all in all, with those things in effect, to also note, as you said, these interviewers were coming from Texas, and they compared us perhaps to the last few who were done, Duval and Hillsborough and Alachua, and we are dislike those districts in many ways. Number one, and most outstandingly, in our A status and in the fact that we are much smaller than those districts. So I think that in totality, we had an excellent finding, an excellent audit review. So I think that anyone who puts this in perspective could not help but walk away with the fact that we did a great job.
Yes, ma'am, and I will even add to that Alachua, while closer in size to us, actually the audit was performed by a different group inside of Florida. And it's interesting to see the differences in outcomes and reports based on which audit firm conducted. So we actually worked with a group that had audited 2 very large districts in Duval and
The
Hillsborough.
climate
So,
they come from.
yes, ma'am.
Dr. White?
Well, just to follow up on your exact remark, Mr. Horton, it's very, very difficult, in my view, to compare these audits when in fact they're performed by different entities, really from all over the United States. Just as a matter of curiosity, I have a question though. Who paid for this audit? Do you know if the school district will be billed, or is that going to be a legislative appropriation? Okay, all right. That was just curious, and I think Dr. Kelly is exactly on the mark. That I think it's fair and it's rightful to tell the public that there are 3 categories that are judged by these auditors, not 2. There are 3 categories. And those 3 categories, again, were, Mr. Horton, they are either met,
Partially met, or not met.
and in the case of not met, just to reiterate and to do what Dr. Kelly said, to underscore, in the case of not met, how many areas of this comprehensive audit in Okaloosa County were not met?
0.
0. And I think that's the whole story, the full truth, the honest truth that ought to be told. And by the way, I think also it'd be important to point out that beginning on page 156, you guys provided a response to all of the different partially met items. And I know that certainly in the case of our attorney, and you've mentioned this, that we're already moving forward to have those items all fully met. And I'm grateful for that.
Yes, sir.
I know it's a lot of work, but it's important.
Yes, sir.
Thank you.
And real quick, Dr. White did ask a question on the cost of this, and just so the public can hear, because I don't think they heard Ms. Scallon say, but who is paying for this?
Right, the district's not responsible for paying for it.
Okay.
But ultimately, the taxpayers are if it's coming from a federal, from a state level.
Okay. Well, the question was asked, and I just
Yes, sir.
wanted the people to hear that. Mr. Destin?
It's just a step we have to go through to have the referendum placed on the ballot. We passed through without being shot down, so that's a good thing. And as Lamar said, everything that's in there, we have a plan in place to improve any questions they had. So I think the citizens of Okaloosa can be confident that when they vote in November, that we are taking all steps necessary to meet all the guidelines the state have set.
All right. Thank you, Mr. Destin. Thank you, Mr. Horton.
Yes, sir. Thank you.
All right. So now we'll move on down to the consent agenda, section 8, and 8.1 will be approval of the consent agenda. 8.2 will be approval of the minutes of the workshop meeting of August 20th, 2020, minutes of regular meeting of August 24th, 2020, minutes of emergency meeting of August 26th, 2020.
I'd like to make a comment on that, which
Yes,
may
ma'am.
seem a little unusual, but I just want to do a shout out to Miss Mary over here who had to transcribe all those. She did a transcription for 6.5 hours when we had that special meeting. So thank you so much for your work on that. I appreciate it, and I know that all of us do.
I concur with you on that. So 8.3 will be appropriation of District 4 School Board member capital outlay funds to Crestview High School for band room flooring in the amount of $16,252.38. And I will just say I'm really excited about this particular item because if you've been into Crestview High School's band room, it is long overdue for some new
Many
carpeting.
years in that band room.
Yes. And I was going to say, Dr. Kelly, I know you were a band parent at Crestview High School, so you know what I'm talking about. 8.4 will be appropriation of District 3 School Board member capital outlay funds to Kenwood Elementary School for car rider, fence, and sidewalk extensions in the amount of $5,335.15 presented by Ms. Linda Vancheck. 8.5 invoices to be approved for payment. 8.6 school donations. And if you look, it's still exciting to see how many of our community partners, parents, everybody who is still making donations to our schools. So we do thank you. 8.7 budget amendment number 11 fiscal year 2019 through 2020. 8.8 revised monthly financial statement for June 2020. 8.9 was deleted. 8.10 application for impact aid under PL 81-874 for the 2020-2021 school year, naming Superintendent Marcus Chambers as the authorized representative for the board. 8.11 exempted purchase over $25,000 Brain Pop. 8.12 exempted purchase over $25,000 Explore Learning. 8.13 exempted purchase over $25,000 Edmentum. 8.14 renewal of exempted purchase over $25,000 Blackboard Incorporated. 8.15 tag-on bid purchase over $25,000 for Train. 8.16 service agreement number 21-47 Brent Purcell. 8.17 sale and disposal of surplus property. 8.18 addendum to motor vehicle lease for disaster transportation services entered in between the School Board of Okaloosa County and Air Force Enlisted Village Incorporated, doing business as Hawthorne House. 8.19 amendment to the Okaloosa County School District's Mental Health Assistance Allocation Plan. 8.20 Okaloosa County School District 2020-2021 Pupil Progression Plan.
Mr. Bryant.
Yes,
And just
Mr.
very
Chambers.
quickly, I do want to thank Ms. Lightboard, Mr. Palmer, the schools that work on this document. As you know, this is a critical and vital document to the school district. And in the midst of COVID, you know, some of these items aren't as noticeable sometimes. But as you know, this is huge for our school district. And as well as some of the adjustments they've had to make because of COVID to adjust pieces within the pupil progression plan. So I just thank Ms. Lightbourne, Mr. Palmer, and the work that they've done with schools, because this is a critical document for our school district.
Thank you, Mr. Chambers.
It is a critical document, and I want to congratulate them. The changes they made are both rational and logical, given our circumstances. And I had a discussion with Mr. Palmer, and I think they're appropriate changes.
Thank you.
All right. 8.21 Coronavirus Prevention and Response, Sanitation and Cleaning, Governor's Emergency Education Relief Gear Fund under the Coronavirus Aid, Relief, and Economic Security CARES Act, presented by Amy Dale. 8.22.
I have just a quick question.
Yes, sir.
On that one. I think I saw that the narrative is still being completed, and that we'll be receiving that, but I know that you guys just received this and that their turnaround time didn't quite fit our board calendar, and so I certainly understand, but I'd like to receive a copy of that narrative.
Absolutely.
Okay.
We'll get that to each of you.
All right. Thank you, Mr. Chambers. Thank you, Dr. White. 8.22, proposed increase in athletic event gate fees for Niceville High School, excluding football, for the 2020-21 school year.
I have a question about that.
Yes, ma'am. Go ahead, Ms. Vancheck.
So, how do we normally do, we're not talking football, we're talking about other sports. Do we try to keep those ticket prices standardized throughout the schools, or are we allowing schools to decide based on their community what that ticket price should be?
No, absolutely. And I can see Ms. Lightbourne's coming up because she worked directly with this, so we'll let her address it.
Okay.
So yes, typically the schools set their own. However, each year, I think it was Fort Walton increased theirs last year. So there's a process they have to go through, and it has to go to their SAC, and then their SAC approves it. And that happened at Niceville at the end of the school year. The problem was with all of the COVID, it didn't come to the board in typically May like it usually does. So it's coming now, but they went through the process to have theirs be in line with what Fort Walton did. Choctaw is probably going to do that next year so that they're kind of all in line, but they had not gone through the process at the end of the school year because of COVID, so they didn't meet with their SAC to have that approved. But it goes through a process, their SAC approves it, and then it comes to the board to go ahead and make those increases.
So do they do it separately for each sport, or when they meet?
Typically, it comes as a package.
Okay.
Mm-hmm.
Okay, great, thank you.
And that's not season tickets, that's just their gate prices. Season tickets are up to the school.
Well, and because especially on the high school ranks, they typically all play each other. So if you're at one school, you're paying X amount for a ticket, but if you happen to be the other one's the home team, it's,
Correct, and
then
that's why the
community has trouble with that.
yeah, why is it this much here
Yeah,
and that much
yeah.
there? And that's why they are all trying to get in line, and I think Choctaw's the last one to get there, but they'll get there by next year.
Okay, great, thank you for that.
And I just noticed that, of course, I noticed the other day when it came down was that this wasn't including football. So this was for all the, what we consider minor sports. So,
Yeah, that's
okay.
important, yeah.
All right. 8.23, School Health Services Plan for 2020 through 2022. 8.24, Employee Benefit Program Renewal for the 2021 plan year. And Mr. Frakes is in the audience. I know he would like to talk about that.
Good morning, school board members, Mr. Superintendent.
Morning.
We are presenting today the renewal of our employee benefits package. The Benefits Oversight Group recently met and voted to approve each of the renewals that you see summarized on the documents that were attached to the agenda item. I won't belabor most of the package. As you can see, most of that renewed it with rate holds. In other words, no rate increase was due on any of those were outside of the medical package. So, in fact, Delta Dental came back to us and actually decreased theirs due to a part of the COVID Relief Act that they're providing. So they decreased our premium by 4.17% there. The only other change of note there was with regard to the life insurance through Sun Life. They are offering us a modified open enrollment, a special open enrollment this year that will enable employees to go in and elect optional life insurance coverage. The district provides a base plan, a base policy of $25,000. The employee can buy additional coverage given certain parameters. They'll have the ability to do that this year, either add to, or if they have not previously made that election, they will have the opportunity to do so this year. So that will be communicated during the open enrollment process that is upcoming. I should probably back up just a second to say that the Benefits Oversight Group, just again to review that, is a committee made up of members of both personnel from the district and the representative unions. that meet on a regular basis to consider benefits issues and make recommendations that are made to Mr. Chambers and then, of course, to the board. So that's how that process goes. And again, they voted to approve each of these renewals. The biggest component of that, of course, is the medical insurance. And you see that was the only increase that we saw. The plan design has stayed the same for all of the programs in place. The medical insurance through United Healthcare will increase by 9.5% this year due to many factors. Of course, chief among those are claims, the number of claims that we have. And this is a sizable increase, and again, we've been in this trend, and this is not something that's unique to the school district, not unique to Okaloosa County. It is something that is nationwide trend that you see increasing medical costs, increasing insurance premiums for group plans especially, and that's one of the unfortunate realities of medical insurance and employee benefits that are being borne by not only the employers and the school district, of course, but also by the employees. Families having family coverage now has gotten to be very expensive, and we are trying to do everything that we can to modify behavior to help push down those costs, or at least push down the rate at which they're increasing, if nothing else. So it's not all bad news, though. So there are some reasons to be hopeful of changes to come in the future, or improvements in the future. So what we've seen, and we've worked with United Healthcare, they do a great deal of analytics on the numbers that are produced by our membership with them. So they have provided us with some information, and the Benefits Oversight Group will be meeting regularly to consider our options. Planning for 2022 will start with our meeting next Tuesday. So we're already gathering information to be presented to the BOG with an eye on that next renewal coming up, and see just how can we influence behavior at the employee level to help push down those costs or control costs. But some of the things that they highlighted in a meeting that we had with them recently were the number of inpatient admissions is down by 5%, so those people are being admitted to the hospital at a lower rate. Non-high-cost claims, and a high-cost claim would be a claim in excess of $50,000. So our non-high-cost claims are down, and our network utilization is very high. So we in turn, of course, when an employee is going and getting care at a network facility, a network doctor, they're getting the best discount rate. The plan is enjoying that best discount rate that's available to them. So that helps to control costs as well. Our generic substitution rate is much higher than UHC would have expected at 97%. So we're utilizing, whenever we're filling those prescriptions, we are utilizing at a very high rate generic drugs. One of the things, to put this in a little bit of perspective, and I thought this was an interesting number that they provided in their executive report. For last year, 2.3% of our claimants represented 45.2% of our total medical costs. So those high-cost claims that we talked about, very few of those are costing the majority of, a very good portion of, I should say, the total costs that we're seeing. So we have to, that's where we'll be focusing our efforts there. Things like emergency room utilization. Getting the emergency room is a very high cost means of getting medical care. So there are other options available to an employee that could get care appropriately at an urgent care facility, or at a minute clinic, or our virtual visits. Our virtual visits are up. That's one of those things that maybe, if there's any silver lining to this COVID experience that we've all gone through, is that people have become more comfortable with interacting with people. We've seen, all of us have done Zoom meetings, of course, and the virtual visit is essentially FaceTiming with a doctor, and it's appropriate for certain levels of care. Not everything, but certainly there are instances where that is a preferred method, and people are finding that it's very convenient, and are utilizing it more. That's a very low cost means for us to administer care, as on the far end of the spectrum from the ER visits that we're seeing. So those are positive signs. And then just some of the issues that some of the conditions that we've dealt with in the past that have been problems with us, we're starting to see some of that behavior change. The tide is starting to turn there, and that is something I believe is the result of some of the efforts that we've made with communication on different things that have gone out to employees through United Healthcare, through that FBMC, our benefits broker, has assisted us with. Diabetic claims are down by 25%. Hypertension is down 7%. As I said, virtual visits have increased, and our musculoskeletal system related claims have been reduced in the high cost claim sector. So there is some reason to have hope that we'll continue to we'll see some of those things change in the future. And we're starting to make some inroads there. We'll continue to do so. That's, again, something that we'll be planning with our benefits oversight group. We'll be considering what efforts we can push forward the next year to have an impact on the next renewal that we see. So any questions that anyone has about any of the renewals?
I'll start with Ms. Ivanchek.
Well, Mr. Frakes and I had a long conversation.
We did.
And he also provided me with some other information because this package does not set well with me. I think this is a hardship on many of our employees. And he already knows, and I'm going to say it publicly, this isn't any reflection on the committee. I know they're doing what they can, but I think our district can do better for our employees than this. I'm looking in my hand, I have the last going for 21, back to 20, back to 19, back to 18. So in 18, it went up 9.4%. 19, 12.8%. 20 went down to 5.5. Now we're back up to 9.5. This is a hardship on many of our employees, particularly those in lower salary ranks. And I think that we just need to, I'm looking at this, and if you are the employee, maybe a single parent or the main breadwinner who has to insure your family, even your spouse, this is an extraordinary amount that you have to have coming out of your pay. So in the short amount of time I had to, after I spoke with him, I contacted a fellow school board member in Santa Rosa County. And that district is a self-insured district when it comes to their insurance. And what that board member told me is that they've not had any increase in the last several years in their premiums at all, and that it's working out very well. And I know that, and I'm certainly not an expert in risk management like Mr. Frakes and his group, but I think this option needs to be looked at. It may not be what Okaloosa, we're not identical to Santa Rosa, but just in wanting to check that. I did quiz Mr. Frakes pretty intently about working with Okaloosa County, not just the district, on looking at things. He said they probably wouldn't want to be with us because our statistics are not that good for many reasons. But I just can't in all goodness vote for this and put this on our employees. I can't imagine what some of them will do. And I do appreciate that some items like dental and others didn't go up, but and if it continues at this rate, I know you were saying you're trying to look at things and all that, but
Yes, ma'am.
if I'm United Healthcare, I'm thinking, why not? We're paying it. It keeps going up, but even in the 3 years since I've actually been retired as a classroom teacher, it's gone up, 30-something%.
Yes, ma'am.
That's what, certainly we haven't hit the salary schedule anywhere near that. We're just not able to give the kind of improvement on salaries. It just isn't there. But yet we're continuing to hit our employees with this insurance. And I'm just trying to do what I can to work with you in finding a solution that might be better. And again, no criticism to your committee or anyone like that. I know you're doing what you can, but I'd like to hear some discussion from my fellow board members about looking at some options of maybe going self-insured. And I know that our attorney sitting there, I'm sure he knows that there's different things about that, but I think that we can do better for our employees, particularly coming off this year when people have had extreme hardships with COVID and personal situations and their financial situation hurt and so forth. I just think that we need to, so how could we look at that, Mr. Frakes? Is that something that your group can do? Are we too late in the game for this year to do anything but go with this? Could you please give me that information?
Sure, and in fact, I should have mentioned that Vicki Whaley, Vice President of FBMC Benefits Management, is here as well. She's, FBMC, again, they're our broker, our employee benefits broker, so she's here with us today, and FBMC has a great deal of experience with just that topic, so I would really defer to her. That's nothing that we've ever done before.
Okay.
We've been fully insured since we've offered benefits, so we've not had that self-insurance experience, but FBMC certainly has clients that do similar, have that arrangement, represent other school districts as well. She could probably speak to that, and certainly it's something that they can act as a resource if we have information or have questions about or want more information about just what that would mean for Okaloosa County schools.
So before she comes up, I'd like to ask a follow-up question, Russ.
Sure.
Okay, so we pay 100% for our employees, correct?
That's 100% of the single rate.
For
correct,
single rate?
Correct.
How many other school districts throughout the state do that?
There are not very many. There are
Okay.
very few that do that anymore. It's that tide has turned. Most districts have some level of participation by the point of on the part of the employees. I think it's down to just maybe a small handful out of 67 counties that offer that still.
And because of that, that's probably one reason why we might see that type of an increase versus if we kind of spreaded it out, let's say 75-25.
Well, yeah, as far as what the district is going to shoulder in that
Right.
in that respect, yes. The overall that 9.5% would be an aggregate increase. So,
Right.
again, it is with the district paying that full amount of that single rate. So, an employee that has the single base coverage, they won't see any increase
Right.
each year that it's been going up. Their paycheck has not been impacted, and that's by far and above. As far as the percentage is concerned,
Right.
we have far more people that have far more employees that have just that single coverage on the base plan. Now they do have an option to purchase that, to buy that coverage up
Right.
to a even richer level of benefit for a pretty nominal. It's
Right.
about $150 this year. Of course, that will go up 9.5% next year, but to that extent, for the most part, you're absolutely correct.
Right, and I think y'all have done a great job over the last couple of years explaining the benefit of the insurance, about how you can buy up,
Right.
things like that. But I did want to follow up on her statement there about the overall package. But again, we do pay 100% for single,
Yes.
which is not typical across
That's very true.
across
Yes,
the
absolutely.
spectrum there. So.
That's true, but as far as United Healthcare, to them, it shouldn't matter whether the district's picking that or not. They're looking at the whole package.
correct.
So
You're
that's
correct.
just, so that,
You're correct in that.
to me, that doesn't make any difference on what they're going up on because,
They're still getting that
know,
9.5% on the aggregate
yeah.
plan, yes. Vicki, do you want to speak to?
Yeah, so I do just want to make one point, because you mentioned, whether or not the benefit oversight groups looked at the self-funding before. With the benefit oversight group, we spend the better part of the year planning and preparing for the next renewal. So, as Russ mentioned, we've already been working on, plans for next year's renewal. And self-funding is one of the conversations we've had more than once in the few years that I've been supporting the Okaloosa County School District. We always take that into consideration, but there's a lot of factors that go into self-funding that is very important for you as a board to understand. Self-funding, I'm a huge supporter of self-funding in general when you get into a large public sector employer, because you're stewards of district funds, and with that there comes a lot of responsibility. Well, in evaluating that, there's also considerations that have to be made around what the impact to the staff will be, not just in year one, but in years 2, 3, and 4. So oftentimes when employers hear, oh, self-funding could saved me 30% in the first year, what they forget is in year 2 and year 3, you're now covering claims from year 1, year 2, and year 3. And so your expenses can actually go up in years 2 and year 3 in self-funding if your claim trend hasn't been addressed. You know, the points that Russ mentioned about the hypertension and the diabetes going down, that makes this the most favorable time to start talking about it, because when we first came into the plan, when we first came in and started supporting the benefit oversight group, one of the things we noticed was there's a lot of high cost claimants that were being driven by, you know, hypertension, musculoskeletal issues, and diabetes. Well, if you don't have those situations under control, what you could be doing is increasing the district's costs through stop loss insurance and other factors like that. And if you can't control the claims and what's underlying on those claims, the way that employees spend today impacts your high cost claimants tomorrow. You know, as Mr. Frakes mentioned, high cost claimants are 3% of your population, driving 45% of your total expense. So if we're not getting these folks healthy when they're not high cost claimants, and then they start moving into that, then what we could be having is a larger problem down the road. So it is something that your benefit oversight group evaluates. We have brought that conversation several times, and it's something we consider, but we have to look at the disruption, total trend on the claims in general, also what's the trend in the market that you're in, where your employees are accessing health care. Unfortunately, here in the Panhandle, one of the things that we're noticing across the Panhandle, from Escambia all the way over to Bay County, is an increase in the access to care, period. Primary care physician, the cost to go to a primary care physician has gone up on average across the Panhandle 24%. So a visit that used to cost $100 now is $124, which seems nominal to start with, but as you compound that by thousands of employees making multiple visits a year, it adds up. And that's not something that's unique to Okaloosa County. Like I said, that's something we're seeing across the Panhandle. And so I do think that we need to continue to consider it each year, and we're probably in a better position now than ever to have a much more deeper, in-depth conversation about it, because we're seeing some of those trends in what you consider chronic conditions. But I just want to make sure the board understands it's not a one-stop solution. And if we don't manage it well, both from the employee perspective, where employees clearly understand the way they spend money will impact what they pay next year. And I think that's one of the communication pieces that we talked about in the last benefit oversight meeting, was really making sure employees understand how you spend today impacts what you pay tomorrow. It's just like car insurance. If I go in and I hit my deductible every 6 months, guess what my car insurance is going to do next year? And for some reason, sometimes employees have a hard time connecting that same thought to their health insurance.
Oh, I just had a quick question, and Russ, I know you can probably answer this in your sleep, but I remember when we went from Blue Cross Blue Shield, a couple of other board members might remember that too, to United Healthcare.
Mhm.
Have we compared again the cost of maybe moving back to Blue Cross Blue Shield, and any cost savings in that regard?
Well, FBMC's involvement with our district enables us to have those conversations without necessarily having to put an RFP out. FBMC is there we're in a brokerage services model now with them, as opposed to how we were previously, where we would just put out an RFP, see what came in the door essentially, and whatever broker brought that piece of business was that broker for that piece of business. So FBMC is out there, and with one of the primary areas that they assist us in is finding out what's going on in the marketplace right now. What is there an option for us to get less expensive coverage? So, and I can't say for certain that Florida Blue wouldn't come in and say, yes, we can save you. We'll do it more cheaply than what United Healthcare is doing it right now. That might be the case year one, but I certainly think that, and Vicki may be able to speak more to that as well, because she's got more clients, and I'm sure certainly has clients that are with Florida Blue. So, Vicki, do you want anything you have to chime in on that?
Absolutely. So what we're seeing in the Florida Blue market in this North Florida territory is the same thing we're seeing with United Healthcare. The challenge is we could definitely take it back to Florida Blue this year. We have evaluated that in years past, and the cost differential was very little. And so we can look at it again for this year if it's something that the board would like to look at, but I can tell you across the board, the rates that we're seeing for the cost for care is similar in Blue Cross as it is in United. So I don't expect there would be a huge difference in premium. They may come in year one with a lower premium, but once they have a full year of claims history, that premium could go up in year two. So it is definitely something to consider, and we look at each year to see what carriers are stronger in the area and can still bring a strong network. I'm sure you remember that transition from
I
Blue
do.
Cross to
I
United.
do remember it.
It took the
And
better part
having
of
to
2
go
years.
to doctors that were not in network that now are, and trying to figure that out.
Right, and that can create a great deal of disruption for the employees trying to figure out how to get, to care that they need. And so we're very respectful of that in addition to the cost.
Dr. White?
Thank you, Chairman. Well, I appreciate the information, the presentation. I think Mrs. Vanchek is, she and I are on the same team in terms of, I don't like the increase. There's no question, and I'm sure you folks don't either. I would just say that hopefully there might be some national legislative changes forthcoming, just like that are occurring with prescription drugs in terms of health insurance, that might make a significant difference to the cost of such, but that's on the hope, and it's not here now. I am curious about surrounding school districts in terms of what their increases might be.
Absolutely.
Yeah, Vicki
Um,
spoke to that.
Right, so we do work with several of the school districts here in the Panhandle, and so that gives us a little bit of perspective. And it's very important to note that probably the reason that I keep going back to the Panhandle is because the cost of care here is very different than
Right.
if we compared you to a Duval County or Orange County. But whenever we evaluate that, across the board, I understand that Santa Rosa mentioned that they did not have an increase in the cost to their employees. But it was interesting to me as we were doing our benchmark data that their cost for their budget line item did go up by 10 to 12% year over year. Now that doesn't mean that's directly driven by the health insurance, but I think it's a very different conversation to say that a school district didn't have a budget increase, a budget line increase, versus there was not an increase passed on to the employees.
Right.
In addition to that, the
I meant by
benefit-
for the employee, yeah.
Absolutely. And I think the benefit design makes a big impact whenever we're benchmarking. As we were trying to benchmark Okaloosa County School District against other school districts, it's important to note that the plan design makes a big impact there. If you all have a very rich plan, which you do, and you compare that to a plan that's maybe a higher deductible plan, you're not comparing the same thing, and so the premium is going to be lower. They may not see the same increases because it's not as volatile when the employee is paying more out of pocket than the employer is paying in premium. But from a benchmark level, we do have some of that reporting, and we're more than happy to share that with the board.
Well, maybe you could just summarize, did the costs go up in these surrounding districts as well?
Unfortunately, yes. That's what I'm saying. So the budget lines, they may not be passing it on to their employees,
Right.
but the budget lines that we saw were increasing 10 to 15%.
10 to 50, so there's a range.
Mhm.
Okay, so, well, you said 10 to 15, and we were at 9. All right. Yeah, a couple of other questions
Yes,
quickly,
sir.
Mr. Chairman. Should the school districts that, and I'm just not familiar with being self-insured, but do they have additional costs associated with being self-insured, like overhead costs, for example, adding district personnel to manage that?
It can be. It depends on how the district decides to set up their, self-funding has a very wide range of what it looks like, from what we call an ASO contract, an administrative services contract with a United or a Florida Blue, all the way through to being a full TPA third-party administrator model. I believe Osceola County School District just went to the third-party administrator model.
So that means additional personnel costs?
That can mean additional personnel costs. And so it really depends on the range in which you go into self-funding. There's a lot of different variables there. Initially, you can see a savings because you no longer pay state taxes when you go self-funded versus a fully insured plan, and so that can result in immediate savings. Another thing that's important to note is the patient-centered PCORI fee that has to be paid on an annual basis. Currently in a fully insured, that's being paid by your carrier on your behalf. At the point you go self-funded, that is a tax filing that has to be done by the district. We support districts that are doing those and provide them the information that they need with that, but there's still there's limitations on how much we can do on behalf of the district. So there is a little bit of an administrative change. It can result in immediate savings, and if the claim trend is running well, you can see long-term savings. But it's important to note that even going self-funded doesn't mean you're gonna see where you never have to raise premiums again. I've been in this business about 20 years now, and I can tell you I've never seen a self-funded employer never have to do increases. I've seen where we can get it to a point where maybe you could do a rate hold for a 3 to 4 year window, but that's because you price in the beginning for the increases that you may see over the next 3 to 4 years, and you make a lot of assumptions. But then at year 3 or 4, you're probably going to be looking at another 10 to 15% increase. So
Okay.
there's a lot of factors that go into
Well,
it.
And that's helpful information for me, and I think I heard you say that you could provide us with more information, and I would be interested in that. I would like to go back to Mrs. Vanchek's other question, and that is, so what happens if this doesn't pass?
The rate increase in a fully insured situation, if this does not pass with the board, our option would be to go back and let United Healthcare know that it does not pass, and we would immediately have to be looking at alternative options or alternative plans, increasing the cost to the employee through out-of-pocket expenses.
But when does this impact the employees?
So we do the renewal in October. We start educating employees on the renewal in October, and the rate change goes into effect in January.
All right. So should this not pass, does that give you enough time to do all that?
It would be very difficult to ensure that employees knew and understood what was happening.
And so that's what you meant, I think, when you said that you start doing this a year ahead.
Absolutely.
And so I would be interested in receiving more information about self-insured in this forthcoming year.
Mm-hmm.
But I think what it sounded like to me, it might be too late to do that now. But that's just what I'm hearing. I'm not sure that that's accurate. And I appreciate all the work. And just the final thing, I believe that the Benefits Oversight Group, the BOG Committee, that's a negotiated item. Is that correct? I mean, the reason we have that is because it's contractually required.
It's established. It's provided for in the master contract. You're correct.
And so are we saying that the collective group of employees and district staff, they are recommending this approval?
That's correct. Yes, sir.
All right, so the employees and the district staff are in full recognition of the rate increase, but they still have brought this forward with a recommendation for approval.
That's correct.
All right, thank you. That's all.
All right, thank you. Mr. Dessa?
My only comment would be I understand what Mr. Vanchek is saying, and with 30 years worth of government experience, what happens when the premiums get to the point that they are so painful, you put it back out to bid. That's our alternative. We did it. We were Blue Cross Blue Shield. In 6 terms in Destin, we changed companies 3 times, I think. And we are getting to that point, in my opinion, with these 9%. And that's just, it's a pain, as we all experienced when we switched. But at some point, the only way you're going to get a true bid and a true rate from these insurance companies is to open it up to bid and put out an RFP. And I would say we are getting very close to this. I think when we switched to United, they gave us a promise that the rates would only go up a certain amount in the first 2 or 3 years. We're out of that time period now, so it's time for them to make their money. Mm-hmm. Well, the way to diffuse that is put it back out to bid and get another company. But it is complicated, and it's a pain in the butt because you have to go through all the changes. But at some point, if they go up enough, it's worth it. And in my opinion, we're getting very close to that now. So I guess at some point we need to look at an RFP for next year and put it out and see what's out in the marketplace and what somebody's going to offer us.
Well, and I hear you there, because obviously she's already stated they're working on that now. So would that be something we would have to move pretty quick? I mean, move soon on?
Yeah, we would start. I mean, again, we have Benefits Oversight Group meeting next week.
Okay.
And we'll begin conversations about, planning for 2022 then. And we will meet more frequently with our Benefits Oversight Group. They expressed an interest and a desire to do that, to look at these things sooner, so we'll get ahead of that and have bring those options, potentially report back to the board if that's what you desire as well.
Right.
Earlier in the course of the year, as that planning moves
Right.
forward, when we've gotten some information in, and have perhaps a plan in place, or some thoughts as to what we
Right.
might do to report to the board, and just what that plan is and how we will approach this for the 2022. We're already planning for that renewal. Then just to let you know what's going on and apprised of what approach we'll take.
Right, and that's why, I asked that on behalf of Mr. Destin there, if we do this and giving you
Right.
what you need now to move forward instead of being back in this position next year. So
Right,
I think,
correct.
I appreciate Mr. Destin, Ms. Ivanchek. Now we need to do our part and help y'all get to where you have a little bit more negotiating room and hold these insurance companies accountable.
But I'd just like to add, when you guys do all that, figure out some way to make sure that all of the providers are gonna be on the new list, because, and I see you smiling, because I'll tell you something, we made that change.
Yes,
It
that
didn't happen
disruption
that
is
way,
different, right.
and
And it was not very smooth, was it?
and I see why, because
Yep.
that means the physician has to complete their
They have to all
paperwork. and
apply.
They have to agree to the new rates, and that didn't always happen. And I'll just tell you that my email traffic went way up.
Absolutely.
Because there were a lot of very unhappy employees because they lost their position that they had, and they would tell me how many years they had them. So I don't know if you can do anything about that, but that'd be real good.
That's certainly a consideration.
And just-
What year did we switch to United?
2016.
Yeah.
16?
Correct.
Yep, I remember.
Okay,
Fine.
so based on what you told me, you were talking about usually when we switch, they give you that incentive going in, okay. Oh, so, but when we were looking at 18, it was going up 9.4%, which is what it is, well, pretty close to now. Okay, the next year, the second year, 12.8. So I don't see that they've really,
Well, we'd have to look back, and I don't mean to
Yeah.
interrupt, but
Yeah.
it might have
Right.
been 2014.
okay.
It was 2016, and we had a 3% reduction in that year one.
that-
Oh, just
In
year
year one,
one.
correct,
So
year
again,
one.
it's an enticing thing to go in, but when
You're
you,
right.
like you were saying, you
The-
gotta look at the big picture of both. But, and another thing to look at is, and I'm sure you can look at this, is I know that we pick up, all of an employees, but maybe we could look at a nominal fee for the employees to offset some of that. That would be another way to look at it. Maybe it's not 100% on the medical paid by the district, but, and so I'm sure there's different scenarios, and you're much wiser about all this than I am. But I do think personally, it's time to look at it rather than just saying, okay, that's the way the market goes and let's move on. I
Understood.
just think it's only fair to our employees to, obviously, we're at a point this year that, not going with it is going to be causing us a lot of grief. But now that you're moving forward in your committee, we could let employees know that we are looking at this, we're aware, and that we're shopping. And I think I could live with that.
And I just wanted to reiterate, I believe it was Dr. White that said a reminder that the BOG is made up of some individuals on the support staff and the instructional staff. And I just wanted to ask how many employees are actually serving on the BOG right now?
The voting members of the benefits there are 5 voting members of the Benefits Oversight Group.
And they're all employees in the school district?
Yes, that's correct.
And do you know how widely they share this information with their colleagues so that
I mean,
everyone is
they're
aware?
representatives from the unions, and they have those conversations frequently
Okay.
about, as you can imagine, employees have questions of them for all
Exactly.
manner of things, and employee benefits are among some of those probably more frequent questions. Whenever there are issues, or whenever they see open enrollment upcoming and you see an increase coming in, those are conversations that they report back, and just in discussion that takes place in that room when we're having those meetings, that yes, they're hearing from employees about these concerns.
And you didn't have a lot of pushback in those conversations
A lot of pushback from.
for the rates increase?
Well, well, it's not,
I'm
nothing's
just- I'm
official
just-
until we
I'm
vote on
just
this.
mind
Matter of fact, it won't be
blown.
official
Yeah.
until
I'm
Monday,
just-
so.
I mean, it's gonna come later.
Just let it- I mean, I
The
just-
committee.
Yeah.
Yeah.
I'm just amazed that it got this far without somebody raising a red flag.
Oh, yeah, well, it's, 9.5% is not, it's.
I see
it-
Patrick raising his hand. Good job out there. Good.
Yes, no, it's not, when you have an increase like that, it's not.
Patrick wants to
it's
say
never going
something.
be
Mr. Strong,
Come on up.
Go ahead.
Come on up, Mr. Strong.
join the party.
So I usually don't jump in because you know I like to be prepared, but I can assure you that your BOG is very astute in overseeing the benefits. And of course, we're very concerned about what the employees are paying. But this is not just brought to us one time a year. We look at this continually. In fact, we deliberately are setting meetings every month this year, and we will be looking at this very closely to include, looking at opening this back up again. But remember that there's costs associated with healthcare, there's overhead, and then there's employee cost. So what we pay out, we have to pay in insurance, and there's overhead. So even when we change, we may have a 1-year gimme kind of thing to get to that new company. But it has to do directly with the doctors that are involved and those discounts that they can negotiate with those doctors. If you remember, we went out on bid previous to the last time, and when those bids came back, we saw immediately that United Healthcare paid more for those medical costs. And we knew that if we maintained those costs in the district, that on our subsequent year, that our healthcare costs would go up. So when United came back and we saw that they had changed some of those things, it was then attractive to change to United. So let me assure you, we look at all of those issues when we're dealing with this.
We don't know what percentage of our employees are on a family plan, do we? Because of course, they're the ones that are
Yeah,
gonna
it's on
bear the
the-
real brunt of
you
the
have numbers
9%.
on
If
the
you're on
percentage,
the single,
but you have
district's
numbers.
paying all of it anyway.
Yes, sir, that distribution is shown, and of course, it is a snapshot. It does change from month to month even, so, but you can see, and just the snapshot that was included during the renewal is, as Ms. Vanchek pointed out, included in the bottom of that exhibit there. So just on a number standpoint, we show that on the family coverage, we have 114 on the base plan, 22 on the buy-up plan, 13 on the copay plan of 2,700 or so.
Small
employees.
percentage, in other words.
Because they
Those-
can't
and
afford it.
It's the family coverage is is quite expensive.
can't
Oh,
afford it.
Well, I
It's
know I'm
quite
paying it.
expensive.
It's,
And
it's
that's
pretty
an
high,
influencer.
thousands a month.
Yeah.
Yes.
No one can, yeah.
Yep.
It's just too much.
Jordan, did you have something?
So, yeah,
Jordan-
Ms.
Jordan is
Alberg,
on-
if you
Jordan is
come-
on the,
Equal
come,
time. Equal time.
come join.
Oh my gosh, have I been indoctrinated in all of it? So I just wanted to let you know, it's not that our oversights group just kind of agrees to everything that is brought to us. There is lengthy discussions that we have, and not only is it talking about our rates and things like that, but then we also have lengthy discussions on what can we do when it comes to informing and educating all of the members that are part of the insurance groups on what we could do to help lower those costs and how to try to look forward into the future. So it's not just that we kind of agree to it and say, okay, well, it is what it is. It's one of those where we ask all of our different questions. Our meetings can be quite lengthy sometimes, but we get to ask all the different questions, and then you have people like myself that are just new into it. I've been in it for about a year now, so I ask lots of questions because I don't speak insurance. So we do ask those questions, but I just wanted to let you know that most of it, it's not just us accepting it, it's us then trying to put together a plan on how we can educate everyone and how we can possibly bring our rates lower for the next year round. One of our biggest costs is emergency room visits. So we've talked about how we can educate everyone on, using alternatives when it comes to using the urgent care or using a minute clinic or using the teledoctors. I know that teledoctors are my favorite thing in the entire world. I personally had to use them when my kids are at lunch, and I've pulled up on my phone real quick because I needed, I started having a bronchitis one time. And so I was able to talk to them while my kids were at lunch, and then by the time I got off work, my prescription was at the pharmacy for me to just pick up. So those things, so that you don't have to go to the emergency room for every little thing. And so education is going to be a big part of this, and that's kind of what we've been looking into.
And I would just comment that, Ms. Appleberg, Mr. Strong, Mr. Frakes, y'all talking about the BOG committee, and I respect and, definitely go by what the superintendent's recommending here, because he's obviously heard from y'all. But you did say one thing there that I was going to comment on, and that's educating our employees on how to use their insurance properly and not just run to the emergency room for things that they can go to the minute clinic or just make a phone call for. So, and I think that's very important that we continue that in educating our employees how to properly use the insurance.
Right, so that's one of the issues this year that you'll see our BOGs start pushing very hard, and Russ is aware of that. We know that wellness issues in this district drive our cost. So you will see a very big push for that, and any way the board can help in that, we would appreciate. If we can divert somebody from going to the emergency room for a sore throat, if we can get them into immediate care or to one of these teleconferences, we save thousands of dollars. And when you do that hundreds of times over the year, you save everybody money.
Right.
And so you will see a wellness push this year.
Right.
I think that COVID will help that, because a lot of people are trying to avoid an emergency.
It hasn't yet.
Really?
Our costs the last few months have actually gone up.
Right.
Yeah.
Yeah, so, and I just want to make a quick note on that. So we see that go up, and we see, honestly, our emergency room utilization in schools is actually higher than what you see in most, because if you think about the times at which teachers and different folks within the district have time to go to the doctor, it's oftentimes after hours and on the weekend, and so it's easier to go to the emergency room than it is to kind of use some of those other resources. But I think that you can see in the numbers that Russ presented, the hypertension being down, diabetes being down, virtual visits being up, are all derivative of the education factor of what the benefit oversight group's been pushing for the last 3 years.
Sure.
Since we've been here and we've been overseeing. We know what, I'm sure they were doing it long before we came along. We've just helped continue to support that, and so I think it is starting to show in the numbers. It's just never fast enough. When the medical trend is going up 24% and you're driving down claims, it's hard to drive down claims at 24%. And so I think that push to education is going to be a big factor this year to continue the direction that we're seeing in the claims. Non-high cost claims being down 1% is huge, because that means that they are less likely to be high cost claims in the future, which is really what's driving 40%, greater than 40% of your claims expenses. And at the end of the day, insurance is a derivative of claims. When claims go up, insurance premiums go up, or if premiums don't go up, out-of-pocket expenses to employees go up. There's only so many ways to deal with it.
Right.
And I think the Benefit Oversight Group and Mr. Frakes' team has done a fantastic job. And I think the numbers, while a 9.5% increase is never good, I have family here in the district that trust me. I don't want to have to talk to them either when this happens. And no, the BOG doesn't just take it sitting down. But this is positive movement in the plan, which is ultimately going to help us continue to drive the costs down. And it gives us better leverage when we do take it to market, or when we consider the self-funding, because now you have a better trend to go into those conversations.
We're doing better now. Can you ring?
Yeah.
Mr. Frakes, one more thing about, we have a lot of employees who have medical benefits through the military, whether retirement and all that. What kind of impact does that have on, because many of them don't really need our insurance per se.
Correct.
They can go and use their, but I'm not sure, is it still TRICARE?
TRICARE.
I don't know what it's
Correct,
called.
yes, that's right.
So do we still pay to cover them as an employee?
Well, as an alternative to the medical care, they receive a board-paid long-term disability benefit. So there
Okay.
is a benefit that's
choose that.
provided in lieu of, and there
Okay.
are about last I looked, I mean, we could probably back it out and do the math here if we had, probably have the numbers in front of us here, just not all put together. There's about 600 or so, 600 to 700 employees that do not take advantage of the medical benefit. But they do receive that, again, they receive that long-term disability paid by the board, so.
And that would help, and there may be others, for example, that maybe not even military, but might have a spouse and they could be covered.
You're
They don't
correct.
need ours, so
That's
they could,
correct.
they'd rather have the disability, and
They-
that's cheaper, right?
It's a an individual decision. What's the best answer for our family in providing that care?
I don't know that that's, well, I shouldn't say, but I don't recall that being well versed when I was in a classroom teacher, so maybe that should be put out, that if this isn't, if you have another situation, that helps.
Yeah, that's incorporated into our,
In
of
the
course,
plan,
we
yeah.
we have our open enrollment each year, and we discuss those benefits. It's one of those things where, we've seen, and it's certainly, we've seen dwindling attendance at our open enrollment meetings, and it's something that's, it's always been that way. It's tough to reach folks during that time. We've done some things to try to increase that. I've gone around myself, Lisa Sunday in our office as well has gone around to some of the faculty meetings at schools to try to at least get in front of folks for 5 minutes, just to give them a reminder about open enrollment, and hit a couple of brief talking points to try to deliver some of those messages. It's very difficult. We'll try, and this year is going to look different than it has, of
You're
course,
gonna
because
Zoom
of
it this
COVID.
year?
We're going to Zoom it. We're going to do all kinds of things.
Yeah.
We've got some videos that we've got that we'll be putting out, email, print campaign as well. So we'll try to communicate those messages and those talking points in as many ways as possible. It's difficult sometimes. A lot of folks do not take very much time to consider their benefits each year, unfortunately, especially considering the costs that are involved and the impact that healthcare has on your life. So we encourage people to do that, to get to take advantage of the materials that we put out there to our employees. Just be aware of what you're purchasing. Be an informed and an educated consumer of healthcare, and take advantage of those things. The benefits that are provided by this district are extremely generous, as some of you have made those points. Take advantage of them. The tools are out there and are available to our employees if they will take advantage of them. We're going to do our part to try to just increase the number of ways that we try to get that education out to our employees to enable them to do so.
Well,
All
thank
right.
you very much, and thank you, Vicki, for coming in and helping with all that. So
Very good. Thank you.
I think, Mr. Chairman, you can sum it up, that the fact that at this point, doing anything but approving this would be not prudent.
Well, of course, you have the option to
I
move
know.
this off
I know, but what,
to
from
discuss.
what they're saying. Yeah.
Right, but I think what I'm hearing from all of you is that we give Mr. Chambers direction to change the way we go about doing this by doing an RFP moving forward. Is that correct, Mr.
That's
Dest?
an option,
An option, yeah.
and one that would, personally, I won't be here when you guys do that probably, but I would be inclined to do it, because every 4 or 5 years you need to go through that process to keep them honest.
Okay,
Otherwise, they get very comfortable with upping your rates a lot.
okay. All right, Mr. Chambers, I believe you'd like to make a comment?
Yes, and Ms. Gallen, do you have anything that you might want to add to this conversation?
Just one short note, because I, like Mr. Destin, won't be here probably next year. But when we, and everything that's been said, it is 100%. But when you have discussions about self-funding, you have to really look at that long and hard. I've experienced that in a former life, and I know what that can bring to you. And what she said was correct. You can start out the first year low, and then your high cost in future years can get you. The other piece is that you need to make sure that if you were to move to self-funding, that then you're going to be required to have a significant reserve. For example, let me tell you, 1 year what happened to us, multiple years, but the high year was that we had a $2.5 million reserve for insurance in case of something that claims that occurred that were not anticipated. Well, one particular year we had $5 million. So it wiped out our $2.5 million reserve, plus we had to pony up another almost $2.5 million. So it's not that you can't look at that, but those are things that you definitely want to take into consideration, and especially in these times when money is tight. So if that happens to you, then you're going to be you're going to have to look at either watering down your plan and taking money from other places and providing less resources. So I just wanted to mention that as you look forward.
Okay. All right.
Anything else? Thank you.
All right, thank you very much. So just, I want to make sure I'm clear here. Board, at this point, would you like to ask Mr. Chambers to maybe look at, Mr. Destin, how did you word it?
I would certainly think that's something you board and the superintendent need to consider going
Okay.
into next year.
Right.
But we still have some time.
Right.
Mr. Chambers, I'm sure you'll look at it, and the WAG people will talk to us. But that's something to look at
Okay.
shortly.
All right.
And it'll take some action by the superintendent and the board.
Go ahead, Dr. White.
And I, not being as familiar as I once was with the contracts, I don't know if that's something that we would actually take a recommendation back from the BOG to move in that direction, or if we could just say, we want you to look at everything.
Right.
All right.
Okay, we got,
Here they come.
Mr. Strong's got something.
I was going to say, board, we certainly do what you want to do, but in the past, the BOG has looked at those costs and looked at what we could do, and when we certainly have recognized the need to go out to bid. So if that arises next year and you don't tell us to do that, we will certainly look at that and decide whether that needs to be done or not.
Well, and I think hearing clearly that the direction is, Mr. Chambers, you'll do what you're supposed to do, and that's the day-to-day operations, and if you feel you need to make that recommendation, then I know you will.
No, absolutely, and I assure you, we'll talk with Dr. Hale, Mr. Frakes, and of course, they'll have the appropriate conversations with members of the BOG through their meetings, and I have no doubt that we will do what is right for our employees.
Yep. And
So
I-
this doesn't necessarily have to be board action, just that
No.
you're going to go and have them look at that after
Correct. Correct.
this discussion?
Correct.
Okay, thank you.
So before I move on, is 8.24, we're going to keep that as is then, right? Am I correct? Okay. All right. 8.25 is amendment to the agreement for school resource officer program between the School Board of Okaloosa County and the Sheriff of Okaloosa County for 2020 through 2021. All right. So we'll move down to Superintendent's Human Resource Business, and the first two will be informational only. 9.1, employees on administrative leave. 9.2, deferred retirement option program. 9.3, personnel recommendations. 9.4, employee transfers. 9.5, employment separations. 9.6, out-of-field report for the 2020 through 2021 school year. 9.7, leave without pay. 9.8, reinstatement reimbursement of sick leave due to line of duty illness, injury, medical examination. 9.9, employee suspension. 9.10, employee suspension. 9.11 has been deleted. 9.12, employee suspension. And 9.13, cleared certification requirements and issuance of contracts for the 2020-21 school year. Section 10, discussion agenda. 10.1, items moved from the consent agenda. 11.1, program status report by the board's representative to the construction program. And Mr. Destin?
Thank you, Chairman. We have a meeting on Monday, and so I will try to get that agenda to you all before the meeting Monday night. Nothing new that I know of that's going down, but if anything comes up, we will put you guys on alert. And Sherman and I have to be at a meeting in Santa Rosa Beach in about
Okay.
45 minutes,
All
so
right.
I will see you all Monday.
Thank you, Mr. Destin, for all
Drive
that you do.
safely.
Yep.
And so we're down to Section 12, Information Technology Seat Management Contract, 12.1, Task Order Number 2-166, Okaloosa County School District Camera Outage Repairs at Baker School, Blue Water Elementary, Bob Sykes, Bruner, and Central Administration. And 12.2, Change Order 17 to the IT Seat Management Outsourcing Contract Modification Agreement, COTS. And 13, we are at Mr. McInnes's business. Mr. McInnes.
No report today.
Okay. 14, Superintendent's business. Mr. Chambers.
Thank you, sir. Few items. I shared earlier that, of course, what dominates a lot of what we do right now is COVID, but there's more to running a school district than just COVID. And here recently, there's a report that schools have to do annually, the Safe Schools Assessment. And Danny Dean, he does a great job leading that venture, and he works with our schools. So each of the schools have to complete this report, and it's a lengthy report, and it also has to come before the board by October. So the next board meeting, you'll see some information on the Safe Schools report. So that'll come to you, and all of us know that right now, having our schools be as safe as possible, not only COVID related, but just safety in general, is a high priority for all of us. So I do want to thank Mr. Dean for the work that he does each day in helping our schools get through this report, but also with everything that school administrators and their staff that they are doing right now, just COVID related, to also put the time and energy into the Safe Schools Assessment, I think is a big deal and is commendable. Though it has to be done, it's extra energy also. So I just appreciate that. Also, as you know, school performance plans, that's a big deal. That drives what happens at a school instructionally. And I used to like to talk about it as it's the heartbeat of what occurs instructionally within a school. Once again, COVID dominates a lot of what we do, but we are here to educate children, now to educate them safely, but we're here to educate our students. So once again, what our administrators are doing, what our teachers are doing as it pertains to school performance plans, that's a big deal. And as you know, this is a time-oriented process that many times starts in the spring and then culminates at this time right now. So to still give your due and important attention to it is a big deal. And all of those plans come to Ms. Lightbourne and her group. They look at those plans, and then that will also be presented to the board, I believe, in the October timeframe. I do want to say I've had the pleasure to go out to schools the last 2 weeks, like many of you. Haven't been to every school yet, but I've been to many schools. At the start of any school year, there's lines in the car rider line, or there's bus issues, or there might be more kids in the hall. But one thing I will say that I was pleasantly surprised with is how smoothly the start of the school year has gone at the brick and mortar schools. I know I showed up to one high school at about 7:02, and I thought I would see a lot of lines, and that was the first day of school, and there were not. And that's not to say that there weren't lines in other places, but I was very pleasantly surprised. I went to a middle school, one of our larger middle schools next, and it was about 3 minutes before the first period was going to start. Normally, there's a number of students in the halls. Well, there were not. Well, some schools, as you know, when those students are getting off the bus or out of the car, they're directing them certain ways now, so the traffic patterns are different, or the way that we're utilizing our lockers are different. So they've done a very good job of getting students into classrooms as expeditiously as possible. Those are just two examples, but very proud of what our administrators are doing, our teachers, our support staff, of what they're doing right now at the schools, the questions that they are having to take that are different than ever. So they're answering questions that they're not normally used to. So I appreciate that as well. I do want to say, as it pertains to schedules, and I shared a little bit of this last time, and I could talk for probably 30 minutes on this, but I'm not. I'm going to be brief. But what is happening was scheduling across the district from the individuals responsible at the school level with master schedules, from what's happening at the district level as well, and everyone working together to get these schedules done, especially those students on My School Online. And I shared this last time saying it was a monumental task, and a monumental task is probably an understatement to get all of this done. The amount of time and energy that those at the school level and at the district level have put into this is extraordinary. And I know that you're grateful. I'm very grateful for what they're doing. When you look at the district level, what Wendy Meserve is doing, Jessica Ross is doing, Brandon McSween is doing, they're literally, the last number of weeks, correct me if I'm wrong, Mr. Horton, I think they've been going about 7 days a week in this scheduling to make sure that we get everyone done, and then several hours on the weekend as well. And you got to do what you got to do to get school going, but I still think it's very, very commendable. And then, of course, at the school level, those with the master schedules, they're also going 7 days a week right now. So it's just appreciated. Then you start looking at, and not to group them, but I am, food services and transportation, what they have done to be prepared for this year, because it's different. And like as it pertains to transportation, you don't necessarily know what you have until now you start picking up the students and how many students do you actually have, and then making adjustments to routes, and of course, also being down some bus drivers as well. So they have done a phenomenal job. Transportation, food services, we start the year now all of a sudden, and a good thing, meals are free, so now they have to adjust as well during this time with all the adjustments that they've already made. So just very much appreciated. Our maintenance folks, as they've gone out to the schools, they put the plexiglass in front offices, as well as just getting schools ready like they normally do. But ACs have been a big deal, as they always are in this time, but it's even more of a big deal right now in this COVID environment. So to get those things right, so I just appreciate the maintenance folks as well. And then athletics, as you know, athletics has started. Football started last Friday with Baker with a big win. But and you'll probably talk about that a little bit later, Ms. Ivanchek. So I don't bring up football or Baker, but what I do bring up is we're doing athletics, and we're doing athletics in this COVID environment. And there's a lot of safety measures in order to be able to do athletics. And will we do everything perfectly? There's no way I could sit here and tell you that we'll do everything perfectly. But also, for example, when you look at fan capacity, there are some districts who might say we're doing 40% capacity, 30% capacity, 50% capacity. What we are doing is looking at, say, pods, for example. So schools, if when they're selling their tickets, if a family buys a set of 4, they're going to sit in a pod of 4. If they buy a twosie, then they're going to be in a pod of 2. Students will be in a pod of 1. So students, the goal will be for a student to be in the student section, and then 6 feet, another student, 6 feet, another student. I say all that to say we're not designating 30% or 40% capacity. Our capacity will be determined by the pods and the ability to social distance. So once we have that, then we will have our number. So could it end up being that we're at about 30%? It could be, but the social distancing is what we're looking for at these games. So at the football games, it'll be very similar. The goal will be, it'll be very similar to what graduation was like, where you have families together and then social distance. So I just wanted you to know that. The same thing inside the for volleyball. There should be social distancing occurring. Swim, cross country. Swimming, cross country, normally those kids are kind of grouped together underneath tents. It's also a social time as well until your next race or until your next swim. So those things should look differently as well. And then lastly, everything does not go perfectly, and there definitely have been some challenges. And then one challenge, I want Mrs. Lightborn to come up, to kind of talk about the online piece. So online has been it has been a challenge, and especially the elementary online. So we're mindful of that, but we're also very mindful of working with our teachers, working with the families, and working to get this even better. And then another piece that I also kind of want her to talk about, which is a challenge as well, as you have movement of students, then you also have student schedules, and teacher placement is also obviously impacted. But we do want to work through that to the best of our ability, but that's why today's the deadline. So hopefully we can get to a dead period and get normalcy going before the end of the first 9 weeks.
So when we started this process, we looked at what programs were available for elementary, and there's not many. We chose Accelerate. It was one of the programs that the state of Florida said was a good, solid, full program. So in working with Accelerate, we realized, again, it was going to be more difficult than Odysseyware, but I'm not sure as much as we said that, everyone understood that. So if you're in a classroom for 7.5 hours, I'm not sure that everybody understands how much work happens within that time frame. So students are being required to do that much work now at home, and it seems an overabundance. But if they were in the classroom, they'd be doing that much, and it wouldn't seem that way because of the way we set, time things off, etc. So I think that's one of our situations. So we're working on that. We're working on what, if you were a classroom teacher, what would you have students do as practice but maybe not grade? And we do a lot of that, especially in the younger elementary levels, that where we're practicing, but that's not necessarily graded. So we're working on how can we alleviate some of that, both on the student side and the teacher side. We currently have Zoom meetings. In fact, I have 2 today with elementary, K2 at 2 o'clock and 3-5 at 3 o'clock or 4 o'clock, something like that. And we'll meet for an hour or 2 hours and work through some of the issues that the teachers are finding. So we're working on that. One of the things that the program did not provide us with was teacher editions of the program. They could go into the program, but it's actually very complex for them to go into the program, get the teacher's edition, go into the student side, get the student side, see what the student actually had to do. It was very, very time consuming. So the specialists have been working on pulling those together. So I think we have them together and they're going to the print shop. So we'll be able to provide our teachers with teachers editions, and I think that's a big deal to help them grade these items. The program itself doesn't self-grade most of the items, so it's teachers grading. So those are some of the obstacles that we're seeing. That's all at the elementary level. Secondary level, I think we're starting to smooth out. It was really just getting them rostered and getting them in and going. I think we had having My School Online is a whole nother layer because the student is still enrolled in their zone school. So let's say Fort Walton Beach High School, they're a Fort Walton Beach High School student, but they're also a My School Online student. So when the teacher who may be at Fort Walton Beach High School pulled them into their class, they might have pulled them in as Fort Walton Beach High School. Well, they shouldn't have. They should have pulled them in as My School Online, which was a different course. So we had to make some changes there. So that was the obstacle that we had in secondary. So all new things that you really can't predict, and you kind of have to work through those kinks. I know our parents have been very patient. Some a little anxious, and I understand that, and tried to tell them they're going to have enough time. We're going to be okay. We're going to make it through this together. I think the teachers have been fantastic. They're bringing. We have made online teacher email groups, so they email us. We're part of it as well as each other. Some of our teachers have come up with the solutions to the problems and shared with each other, which I think has been actually one of the best values of it of all. So yeah, there's bumps, but we're riding over them and we're getting through. I do want to say this. I felt real good last week because the K-12 program that everybody sees advertised on TV and looks so great, and we do use with our homeschool students, it crashed last week. And then I heard last night that Florida Virtual K-5 Flex was going to stop. I'm not sure if they're stopping taking students or they're down until October. So even though we have bumps with Accelerate, we're still moving and we're still moving along. So I think we'll get that smoothed out in over time. But we're all learning as we're going through this process. So wanted you guys to know that.
Thank you, Ms. Lightbourne.
Mm-hmm.
And I just want to reiterate that the weekly meetings that Ms. Lightbourne has set up, I'm extremely proud about that. But not only with what she's doing, but the teachers who are coming onto those meetings. I mean, you think about it, if it was a school building, it's almost like you're having a faculty meeting once a week. And I know all of us love to go to a faculty meeting once a week, but they're doing it. And I had the privilege to see a few of them, but to watch an issue arise, and then to watch the teachers themselves brainstorm it and fix it. That's a good thing to see everyone working together. But I just wanted to share some of the successes that are out there, give some information, but also share some of the challenges that we're experiencing.
Thank you, Mr. Chambers. All right, so now we're down to board members' announcements and requests for information. And since I've been a gentleman all morning, starting with the ladies, I am going to start with Dr. White for announcements this morning.
And so, Superintendent, I heard all the things that you said that have been going on, and knowing, again, a little bit about scheduling and master scheduling, I just want to commend you and your staff and the principals and the assistant principals and the teachers, because I can only imagine what a mammoth job that must have been, and it still is as these changes are occurring. And I well remember spending extra hours in a normal situation when school would open. But now, with everything going on, and we're running different schedules, and we're doing block schedules, again, just congratulations on getting that all done and letting our kids start school the way they're supposed to. So just wanted to say that and appreciate that very much for you and your staff and your teachers and your principals and everyone involved. And just a quick announcement, and I suspect, Superintendent, you'll have something to say about this too down the road. But to recognize Pryor Middle School, the Florida Department of Education has named Pryor Middle School, one of the schools in my school district, as the recipient of the 2019-2020 Family and Community Involvement Award for their Built by Pryor skills to build architecture and construction class. And I know it's been quite an achievement of Principal Lord there and her faculty, and certainly it's always great when the state of Florida recognizes one of our schools for its achievement. And I know Ms. Vanchek visited and also paid some respect to the school and the principal, and I just wanted to point that out in today's meeting. Thank you.
Thank you.
All right. Thank you, Dr. White. And Dr. Kelly.
Well, I was just going to add some accolades to that district-wide master scheduling. I just can't imagine that, but I certainly think that seems to have gone well, and I know particularly with respect to hiring teachers and making sure that teachers across the district have a class load, and then conversely, not hiring a full-time if they didn't have a class load. I can just imagine, I know how it was at the school level, so trying to do that across 38 schools is remarkable. So I just think that was something to be recognized, as well as some of the other things that have gone on that Sheila and Mr. Horton have both talked about. But I did want to recognize that today, September the 10th, 2020, has been designated as the Worldwide Suicide Prevention Day, and there are a number of activities that have been recommended to do in this day, such as check in with someone and just simply ask them how they're doing, particularly with COVID, and that's been recognized too, along with National Suicide Day, is that the COVID stressors, the isolation, and all of those have been another layer on top of depression and the other typical things that happen in the world of teenagers today. So I think that World Suicide Prevention Day is very important that we acknowledge. And also, and you'll probably have some reports on that too, this is the week that our Hope Squads locally across our district have been nominating their student participants. So I know that you'll probably bring that to us at some other time or have Ms. Brockman come and talk about that. So I'm very excited that the national conference for the Hope Squad, their topic is going to be We Rise by Lifting Others. And I love that our students are promoting that topic too. So I just think that's phenomenal. And also, looking at things happening this week, I know tomorrow is September 11, the anniversary of 9/11, and having some events around that day, and certainly prayers and a moment of silence for our people. But those are just the only things I wanted to mention. Thank you.
All right, thank you, Dr. Kelly. Ms. Vancheck.
Well, yes, I was out in the school a little bit, a couple of schools, and I think we all were somewhat holding our breath. We just haven't done it this way, but I thought it was a phenomenal start of a school year. The feedback I've gotten, what I've seen, actually in some ways I think maybe even better than we've seen. I think because we anticipated some challenges, ultimately it was all handled. And again, it goes to the work at the district, what's happening with those principals, and again, it's just great to be a part of Okaloosa County because we're doing things correctly, and it's going well. Want to do an update on the Public Schools Foundation and mentoring. We are continuing that program even with the challenges of COVID. We're actually mentoring through Zooming, working with those students, and we are still looking for some mentors. And so maybe if there are some individuals out there that may not want to do mentoring, thinking that they'd have to be in person, and that might want to consider it if they will call the Public Schools Foundation number here at the district. We can get them set up. We're always looking for people to help with our students. And yes, I got to talk about my Baker Gators. They actually posted the first win in Okaloosa football for this season. The Gators took the field 2 weeks early. I think most people understand that in the classification they're in, they don't play another school in the district. So they have to go beyond our district. So to meet up with their classification so that they would not be left out of the season and the playoffs, they got started last Friday night against Lighthouse Academy with a resounding 35-12 win. They're going to be playing again tomorrow night. I'm hoping I'm coming in here Monday night with number 2 win going for Coach Brunson and his Gators. And I just want to congratulate them. They certainly have always done a great program up there, and seems like even the challenges of a late start in practice have started off well for them, and I'm happy for them and wish them well tomorrow night as they go against South Walton. So yeah, be a county rivalry there. So thank you.
All right. And I would just finish up by echoing Dr. White's statement. I believe, Mr. Chambers, through your leadership, and like I said at the emergency meeting the other day, the expectation and the culture that has been created in the schools is why we're off to a running start right now. Now, is it perfect? No. But I will say that the schools that I visited on the first couple of days, I would have to say, like Ms. Vancheck said, was it didn't even feel like the first day of school. It felt like they've been doing this all along. But I believe it's because of the expectation and the culture that has been created by our principals within those schools is why we've been successful for the first 2 weeks. And, it's just a great feeling to see that we have kids back in school, our teachers are back in school, everybody's back in school, to see, to have that feel in there. So I know for me it's been really exciting just to see them in there. If y'all have noticed, I am wearing a shirt. Now, some schools have been giving out masks instead of shirts this year. So Riverside, one of my schools, gave me this shirt, and I wanted to just give a special shout out to Riverside Elementary. Of course, y'all know Riverside is near and dear to my heart. My kids went to Southside, but I was also on the SAC committee during that time that the school was approved to be built, and I was actually one of the community leaders that was there to turn the dirt for both Shoal River and Riverside. But I would like to give a special shout out to Principal Melissa Curley and Vice Principal Lori Wagner for the outstanding job that they are doing over there. And again, if you get a chance to visit Riverside or any of our schools, I know it's very hard to visit like we normally do, but you know, say a special shout out to our principals and to all of our folks that are in the schools right now. Any words of encouragement will go a long way. And with that, we do have another section of public comment, and we have a lot of public hearing on Monday night. So this is a big one, and I know Ms. Scallon will be glad to get past Monday night. And of course, she'll be working on next year's budget right away. So 17.1 required local effort millage rate of 3.7860 mils. 17.2 will be prior period funding adjustment millage of 0.0010 mils. 17.3 basic discretionary operating millage rate of 0.7480 mils. 17.4 capital outlay millage rate of 1.5000 mils. 17.5 total millage levy of 6.0350 mils. 17.6 resolution 20-06 adopting the millage rates for fiscal year 2020-2021. 17.7 Okaloosa County School District Budget General Fund for fiscal year 2020 through 2021. 17.8 Okaloosa County School District Budget Special Revenue Funds Food Service for fiscal year 2020 through 2021. 17.9 Okaloosa County School District Budget Special Revenue Funds Other Federal Programs for fiscal year 2020 through 2021. 17.10 Okaloosa County School District Budget Special Revenue Funds CARES Act ESSER Fund 441 for fiscal year 2020 through 2021. 17.11 Okaloosa County School District Budget Special Revenue Funds Others CARES Act Relief Fund 442. 17.12 Okaloosa County School District Budget Debt Service Fund for fiscal year 2020 through 2021. 17.13 Okaloosa County School District Budget Capital Project Funds for fiscal year 2020 through 2021. 17.14 Okaloosa County School District Budget for fiscal year 2020 through 2021 for fiscal year 2020 through 2021. And 17.15 Resolution 20-07 adopting the Okaloosa County School District Budget for fiscal year 2020 through 2021. And with that, I'll go around the board. Dr. Hale, anything? Ms. Scallon? Mr. Strong? Ms. Applebert? Ms. Lightbourne? Mr. Horton? All right, this meeting's adjourned.